Welcome to the first part of our hydration training. In this part, you will learn about the basics of water, hydration, and dehydration. Many older people living in aged care homes, especially those with cognitive impairments, are at high risk of dehydration. Dehydration is one of the most common causes of hospitalization of residents in care facilities, and inadequate hydration is an indicator of inadequate care. Adequate nutrition and optimal hydration are key indicators for measuring the quality of care in aged care. Therefore, it is the responsibility of those who care for older people, whether they are nurses, therapists, or family members in whānau, to ensure residents get the fluids they need. Access to fresh drinking water is a basic human right. In Western countries, every single person, even those who rely on others for care, should have access to the fluids they need to thrive. Water is an essential nutrient which the body loses and cannot produce in the amount it requires. It accounts for up to 80% of body weight and fills the spaces between cells, supports biochemical reactions, and forms structures of large molecules like protein. Water is essential for physiological processes such as digestion, absorption, and transportation. If we do not consume water or foods containing fluids regularly throughout the day, we become dehydrated. The human body needs to maintain a certain level of hydration to maintain a fluid balance and enable the many physiological processes that occur in the body, otherwise it will become dehydrated. Dehydration occurs in two ways, either through low intake caused by failure to drink a sufficient amount of fluids, or through volume depletion caused by diarrhea, vomiting, or excessive bleeding. No matter how it occurs, dehydration is a serious problem and can significantly impact an older person's health and quality of life. Older people who don't drink enough or have increased fluid losses have an increased risk of pressure injuries, low blood pressure, dizziness and falls, cognitive impairment, confusion and delirium, constipation, urinary tract infections, and acute kidney injury. There are a wide range of reasons why older people are at higher risk of dehydration than younger adults. A big one is a decreased thirst sensation. In normal healthy adults, thirst is a signal that stimulates us to seek fluids. Thirst is stimulated when osmolality increases or the extracellular volume decreases. Unfortunately, older people often have impaired thirst mechanisms, and the signal to seek fluids is defective, leading to dehydration. Having dysphagia, or the reduced ability to swallow thin fluids without aspirating, in conjunction with not enjoying prescribed thickened fluids, is another cause for dehydration in older people. Other risk factors include hot weather. Extreme summer temperatures will increase fluid requirements for some older people. Fever, diarrhea, and vomiting cause increased fluid losses and require a higher than usual fluid intake to replenish these losses. Certain medications increase fluid requirements for older people, such as diuretics and laxatives. Decreased kidney function in older people, cognitive issues with forgetting to drink, losing the ability to drink independently or refusing fluids altogether, inability to independently access, administer, or communicate the need for fluids, concerns around continence. Older people restrict fluid intake due to fear of having an accident, and inadequate staffing in aged care to meet recommended regular fluid rounds and assist residents to drink throughout the day. When there is insufficient fluid intake or excessive fluid loss, the kidneys compensate by producing a more concentrated urine to maintain the individual's fluid balance. However, in older people, the kidney's ability to increase urine is impaired and dehydration occurs. Simple signs and tests to assess dehydration, such as skin turgor, urine colour, or weight change, are not sufficient indicators of low intake dehydration. A blood test, or serum osmolality, is the gold standard measure to assess hydration status if necessary. However, all older people living in residential aged care facilities should be considered at risk of low intake dehydration according to the SBEN Guidelines 2018. Other signs of dehydration include dry oral mucosa, recent changes in consciousness, hypotension or low blood pressure if dehydration is present, and darker urine, although this is not an early warning sign.